Hello everybody and welcome to the Thursday edition of Video Clips, and I've been asked to comment about this particular condition, endometriosis, for a variety of reasons, one of which is that the solutions are so dreadful that are offered by the medical community. So anyway, here goes. Let me tell you a little bit about endometriosis. It's a painful disorder that is experienced by as many as 10% of women. The condition develops when tissue that normally lines the uterus, the endometrium, migrates outside the uterus and starts growing. The most common sites are the ovaries, the fallopian tubes, and the pelvic tissue. Endometriosis is usually limited to the pelvic area, but the tissue can spread elsewhere to such areas as the bowel, bladder, and rectum. The migrated endometrial tissue acts just exactly like the endometrial tissue in the uterus, in that it thickens and then breaks down and bleeds with the menstrual cycle. So this can lead to extraordinarily heavy menstrual periods and PMS type symptoms, literally on steroids. You never experienced anything like this. Sometimes the broken down tissue becomes trapped and scar tissue and adhesions develop, which can result in pelvic tissues and organs becoming connected and fused together. When the ovaries are affected, cysts can form and they're called endometriomas. Common symptoms include pain that starts 2 to 3 days prior to a menstrual period and is sustained throughout the period, very heavy menstrual periods, pain during or after sex, pain with bowel movements or urination, nausea, bloating, and infertility. For some women, the pain is not limited to just around the menstrual cycle. It's 24/7, 365 days a year, and it interferes with normal function and living. Patients with endometriosis have a high risk of many things, ranging from allergies, fibromyalgia, asthma, eczema, autoimmune inflammatory diseases, chronic fatigue, hypothyroidism, and even cancer. Risk factors include age. Endometriosis usually develops in women between the ages of 30 and 40. Being overweight, having never birthed a child, history of pelvic inflammation, menstrual periods lasting more than 7 days, menstrual cycles less than 28 days, and then influences are caffeine, alcohol, and lack of exercise. There are many causes. One of the biggest that we should pay attention to and most controllable is estrogen levels. Endometrial tissue contains estrogen receptors, and the tissue grows and proliferates in response to estrogen. The condition often resolves after menopause or oophorectomy, but then resumes if women take hormone replacement therapy. Endometrial tissue also, interestingly enough, contains aromatase, an enzyme that converts androgens to estrogens, which means that localized estrogen production can stimulate the growth of the tissue too. There's no aromatase activity in normal endometrial tissue that is in the uterus. In one case study, endometriosis was successfully treated with an aromatase inhibitor. Inflammatory prostaglandins, such as series 2 prostaglandins, are produced in higher levels from ectopic endometrial cells than normal endometrial tissue. And the reason this becomes important is this is another contributing factor to higher estrogen levels. So what basically happens is high estrogen levels cause the endometrial tissue to migrate, and high estrogen levels cause the endometrial tissue to proliferate. So it's a downward cycle of worsening and worsening symptoms over a period of time. For diagnosis, it's usually after everything else can be ruled out. Endometriosis is diagnosed via laparoscopy and sometimes a biopsy of the lesions. Non-invasive methods of diagnosis such as ultrasound, CT, and MRI are often not accurate, but even laparoscopy has limitations because the tissue can be hidden by pelvic organs or adhesions. In terms of traditional treatment, combination oral contraceptives are commonly used to treat it in order to lower estrogen levels, menstrual bleeding, and pain. Now, the oral contraceptives do not address the causes, so symptoms return as soon as the drugs are discontinued, and one of the biggest reasons for discontinuing the drugs is side effects, which include weight gain, headaches, thrombophlebitis, pulmonary embolism, cerebral thrombosis, hemorrhage, hypertension, benign liver tumors, and gallbladder disease. Many other forms of oral contraceptives are prescribed, but essentially, no matter which class you're talking about, they treat symptoms, not cause. They all have serious side effects, and all hormone-related supplementation is a risk factor for cancer. Surgical treatment includes removal of lesions, adhesions, and cysts, or even complete hysterectomy. The recurrence rate at 5 years is 19% if lesions are removed and 10% if hysterectomy and oophorectomy are performed. Ablation of the uterosacral nerve and laser ablation of the lesions also used for treatment. Sometimes pain medications are prescribed, like nonsteroidal anti-inflammatory drugs, because they reduce the production of series 2 prostaglandins, which then reduces the production of estrogen. There really is not very much research on the effect of diet and endometriosis, and some of it's conflicting. I looked for some clear-cut studies that would show that plant-based diets are better. But studies do indicate in a roundabout way that a low-fat plant-based diet might be best. For example, one analysis concluded that increased intake of fruits and vegetables, antioxidant-rich foods, omega-3 fatty acids, and polyunsaturated fats has a positive effect on endometriosis, and higher intake of green vegetables and fresh fruit can reduce the risk. Where the biggest body of evidence lies is in studies showing that diet can lower estrogen levels, and that's the major risk factor for endometriosis. A combination of high fat, high protein, and low fiber contributes to higher estrogen levels. Another thing that's a big contributing factor is cow's milk and cow's milk products, because they contain estrogen and estrogen metabolites. They contribute to higher estrogen levels. Eating a plant-based diet, on the other hand, lowers estrogen levels. In one study, vegetarians were shown to excrete 3 times more estrogen in their feces and had a 15 to 20% lower estrogen level than their omnivorous and carnivorous counterparts. An analysis of 13 dietary intervention studies concluded that low-fat diets, meaning 10 to 25% of calories from fat, can significantly lower estrogen levels. Plant-based diets contribute in another way too, which is they promote weight loss, since the calorie dilute nature of plant foods promotes weight loss. And this is important because fat cells contribute to high estrogen levels, because fat cells secrete hormones converted to estrogen in the bloodstream by aromatase. So in a roundabout way, the plant-based diet helps in that regard. It facilitates weight loss. One of the advantages of paying attention to weight loss and diet, as opposed to some of these other things, is that it really does treat the cause of the disease. So a couple things. High estrogen levels. You can have a hysterectomy and get rid of the endometriosis, maybe, but high estrogen levels are a risk factor for breast cancer. So if you don't do something about it, sooner or later other bad things can happen. So it's much better to address the cause instead of just dancing around the symptoms of conditions, including endometriosis. Another reason is women who have endometriosis have a 50% increased risk of epithelial ovarian cancer. Ovarian cancers are notoriously hard to treat and have a very low survival rate, so better to do something about this now when you can with dietary change than wait till something disastrous happens. So those are the basics and the things that pertain to most people concerning endometriosis, and hopefully you can prevent the disease with the things that I've told you, and if you suffer from it, you have a good chance of reversing it with the things that I've told you too. Okay, as usual, hit the subscribe button if you're not a subscriber. I'll pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.